Hey guys, Dr. Jake Dodds here, and we've talked about 3 foundational videos in the video series that's leading up to this point. We talked about structure, getting energy, and not losing energy. So now we're getting into more of the fun part because we're circling back around and we get to dive more in depth on each of these topics. Today we're hitting that structure component again, and we got something written up here that says NUCCA. Like, what the heck is that? What are we talking about? Well, I'm a chiropractor, so today we're talking about chiropractic. And the reason is what we talked about in our structure overview video, which is that the human body is designed to operate from a certain position. If it's not there, if we're spending a lot of our time in a twisted and turned position, like most of us would agree that that's not good, but we don't really think about all the implications necessarily. But there's a ton that happens to your body when we're not in the right spot. So it's a very foundational thing, but we need to get to that correct position. And chiropractic and NUCCA is one of the coolest tools that we can use in our tool belt to help us get there. So what a lot of people also don't realize is there's a lot of different chiropractic techniques out there. So I hear this all the time, like, oh, I tried chiropractic, or this happened, or this happened. And there's over 200 different types of chiropractic techniques, and they really range on a very broad spectrum in terms of how they're delivering adjustments. So it can be really confusing, and we as chiropractors don't do a good enough job educating the general public about this. So I want to take a second and break this down a little bit more so we just have an understanding of what we're dealing with. Now, for a variety of reasons, most people have a combination of accidents and injuries, general wear and tear throughout our lives. So, I mean, I think most of us can agree we just don't spend a lot of time in a great position throughout the day, whether that's at the desk, in the car, on the couch. Not to mention some of us have like car accidents, sports injuries, or some bigger things sprinkled in. So what that means for a lot of us is by the time we hit adulthood, we do have some twisting and turning going around. And that's not just like a postural thing, this really goes deep. Again, in our structure overview, what we talked about is we have bones that form joints. We have the muscles, ligaments, tendons, and fascia that are going to move those joints. And then we have the nervous system that tells all that soft tissue how to move our bodies. So we got 3 big players in the game. But again, the joints don't always get a whole lot of attention, even though it literally is the foundation for our body. So again, a lot of people have one hip higher than the other. We got twisting in the low back. We got compression in the low back. I mean, pick your poison. There's a lot of twisting and turning that goes on. So we have 26 bones in a stack in our spine, and a lot of times they're not existing in a good place. So what a lot of people are told is like, hey, you just need to sit up straight, or like, hey, you just need to relax this muscle and you're going to be good. If the joints aren't lining up correctly, again, you're fighting an uphill battle. So chiropractic is a really cool way to get to that really foundational layer and work on the foundation of your body and get these joints into a better position. Again, there's a lot of techniques and a lot of ways to analyze and ways to go about that. I'm going to give you 2 general categories. The first is called full spine, which is what most people are thinking when they're thinking chiropractic. And this is what's called segmental. And all that means is we're looking at the bones individually throughout the spine. And if there's something that's not in the correct position, then we're going to that joint and introducing somewhat of a motion so that we can get the joint back to a better position. So that's looking at it more on that segment by segment basis. Another broader category that we're also going to talk about today is what's known as upper cervical chiropractic. So there's a handful of techniques that fit within that umbrella. And essentially what that means is we're obsessed with something called the craniocervical junction. I don't want you to get hung up on the terminology. It's a pretty simple idea, and it's a fancy word for a simple idea. So what this means is we have the first bone in our neck. This is the really blown up version, so don't worry, your bone's not this big. But for illustrative purposes, your skull sits on top of the first bone in the neck like this. And then we also have the neck that sits underneath like this. So again, this isn't something we always think about a whole lot, but we can actually have a misalignment between the head and the top of the neck. So for a lot of people, the skull has turning, twisting. This atlas bone itself is really unique. It doesn't have a bony overlap like all the other bones in the spine do. So it allows us for all this cool head motion, but it can also lead to some kind of funky misalignments. So we can get slipping left like this. We can get stuff going like this. So I hear this from people where it's like, oh, like I feel like I just got this like thing tied around my neck, or I'm always crimping over this way. Or like, man, this just always feels so compressed in here. And especially if you've been dealing with someone with migraine headaches, these things come up a lot where it just feels compressed, it feels tight, and you don't always know why. And again, the craniocervical junction, so where your head meets your neck, can be a huge, huge reason. So there's 3 primary reasons that us as upper cervical chiropractors are so concerned about this region. And by the way, NUCCA is the chiropractic technique that I practice. It is an upper cervical technique. So again, there's a few techniques that fall under the upper cervical umbrella. The one that I'm getting into today is called NUCCA. So in general though, us upper cervical chiropractors, number 1, we're really concerned about this area because the head is heavy. So not only do we have the weight of the heavy skull, but also the brain and all the fluid that sits in there. A lot of times you're looking at 12 to 15 pounds that's sitting on top of the neck. And guess what? This bone right here that is what everything stacks up on top of is 2 to 3 ounces. So we got a lot of leverage here, and the head is such a huge leverage point, both neurologically and just from a biomechanical standpoint. Like, if you can just imagine a bowling ball on a stick, like if you start tipping that around, it's gonna take a lot of effort just to hold on tight. So the body goes where the head goes, and if we got something like this, for example, then your body has to do all this stuff, and it's pretty cool because your body does it automatically. Like, it will do any twisting, leaning, anything it needs to make sure you can stay upright and as functional as possible. And you can do this for 10, 20, 30 years before you even start to show pain and discomfort. So it's actually really incredible what the body can do. But over time, if the head's in the incorrect position, there's gonna be other stuff showing up throughout the rest of the body as well. So just the fact that the head is so heavy is the one reason that we care so much about this area. Number 2 is the brainstem. Again, I don't want you to be afraid of the term. All it means is what we have is the brain sitting in the head. It transitions down into the spinal cord right here at the top of the neck where that first bone sits. And it's home to what we call the autonomic nervous system. So this is the automatic part of your body. You don't have to think about beating your heart. You don't have to think about digesting your food. And for the most part, you don't have to think about how to coordinate your movements and keep your body upright as you move throughout the day, because we have something called the brainstem, which takes care of the automatic part of our nervous system. And a lot of these are really foundational things that keep us alive. So what can happen though is if we have twisting and turning, we got compression, we got restriction, what happens is we got a pretty narrow hole here that there's billions of nerves coming through. And again, these are the central processing nerves that like take care of our existence. So if we have kind of a funky misalignment here and things are compressing, it's not like the nerves get like pinched or like completely severed, but the function of those nerves, and there can be inflammatory reactions that happen here that affect how well those central regulatory nerves can function. So guess what? If your control panel on your air conditioning is broke, it doesn't matter if you have the best air conditioner in the world, like it's gonna mess up your house. Same thing with your body. Like if you have a central control panel signal that's wrong, especially when it affects our posture, then what we can get is sometimes people will get these message from the brain that's causing restriction or causing muscles on one side of the body to compress more so than the other. So again, this is one of the reasons that we love focusing on this area so much, because if we got compression going on and the brain is telling the body on one side to contract more than the other from the muscles, and you're like trying to stretch and you're trying to exercise and you're trying to open this up, it gets super frustrating because again, your brain is telling your muscles to do one thing, you're trying to get them to do something else. It's a losing battle over time. So hitting the reset button on that central control panel at the brainstem, we just see so many cool changes with it. And it's one of the reasons that we have this conversation. People are like, oh, like why do you only take care of up here? Like I got this whole spine. Well, because if you work with the control panel, you can make really cool changes with the whole body. And we see that all the time. So believe it or not, getting this area corrected is one of the fastest ways to help things like low back pain and other things throughout the body, even knees. Like there's just so many cool things that can balance out. Your brain knows how to take care of your body, but it needs to have the opportunity to do so by making sure those nerves aren't getting irritated. The last really important thing, and again, we don't always think about this, but fluid flow. So when I say fluid, I'm talking about 2 things. Number 1, blood flow. So we have, for example, 70% of the blood that's coming to your brain is coming through this little hole right here in the side of the atlas bone that sits right here. And the real size of your atlas is about this big. So we're talking about some pretty narrow windows. But again, if we're getting compression rotating, it's not too much different of an idea than like if you got a hose and you start kind of messing with it, like the hose isn't gonna flow as well. The same goes for your blood flow. Now, there's actually a group study done on 20 people with migraine headaches by the NUCCA organization, and they used something called a functional MRI. It was looking at the blood flow coming out of the brain before and after an adjustment. What they found was after the head and neck were aligned appropriately, people were showing up to 60% better drainage of blood from their brain. So if you can just imagine, like, do you ever feel like your head's gonna explode? Do you ever feel like there's just way too much pressure in there? Like, could it be as simple as you have fluid restriction because things aren't as open as they could be? And I'm not saying like this is the only thing that shows up, but again, when we're talking about foundational layers here, like this is just such a cool thing to look at to make sure that you're not dealing with that on a consistent basis. So number 1, we want to make sure the blood is flowing to and from the brain. Obviously super important. The brain consumes 20% of all of the nutrients that come through your blood and your body, so the oxygen and sugar. Like your brain is just so energy intensive, we need to make sure it's getting the nutrients that it needs. The other thing that I want to touch on is something called cerebral spinal fluid. Again, the name's not super important, but essentially we got this cool liquid that bathes both our brain and our spinal cord, and it's like kind of this subsystem that really makes sure that, again, the central regulatory mechanism of our nervous system has everything that it needs. So same thing, if we're not getting good fluid flow over there, we can get these stagnations, which over time can really lead to the body not functioning like it should. So fluid flow is super important. One of the other huge reasons that us as upper cervical chiropractors care so much about making sure that this is all correct. So this is why it's important. That's why upper cervical chiropractors look so closely at this area. NUCCA itself is really cool, and obviously this is my biased opinion, but I've worked with people for the past 10 years. It's made a huge change in my life as well, and the way that it works is we get a really accurate three-dimensional picture of what's going on between the skull and the neck. So we want to make sure things are lining up appropriately. For a lot of people, there's work to be done in terms of there's twisting and turning happening. So with the imaging that we get, we can take some really detailed calculations. The other cool part is we get to measure your exact joint surface sizes, so that's going to vary from individual to individual. And all of those numbers and calculations are going to affect our decision of how we want to introduce a force into the body to get everything back into a cool position. So I love it because there's no guesswork. The other part that I love is we calculate everything ahead of time, we get you adjusted, and then afterwards we take post-imaging to make sure we got what we were going for. So sometimes people follow the book and they respond exactly like we expect them to. Maybe you felt like this before, but it's like, oh, my body doesn't respond like I expect it to, or I feel like it's going to. And we see that too. So sometimes we take our calculation and it doesn't always move exactly like we were expecting. But then what's cool is we can take that information and we don't let you leave until we're getting that adjustment that we're going for. So again, it takes the guesswork out of the equation to make sure we're moving things appropriately. Especially when we're dealing with such an important area, that's huge from my perspective, is just making sure that we know we're getting the movement that we need and we're getting you to a good position. Along with that idea, a lot of chiropractic techniques are introducing like a thrusting type motion. One of the parts I love about NUCCA, again, because we're working with such precise measurements here at the top part of the neck, is the adjustment itself isn't a thrusting motion. So some people really don't like the idea of that, or maybe they had an adjustment that didn't feel good at one point. So one thing we hear from our people a lot is like, I love how gentle your adjustment is. So I'm going to be doing a separate video on this entirely because there's some fine details that go into this. But the general idea is we get to use what's called a transductive force. So instead of doing like an impact force, I get to hold my hands in place, squeeze the shoulder blades together in the back, and essentially because I'm creating motion while I have my hands anchored, I'm able to deliver a transfer of force without having to do a big push into the neck. And again, I'll get more into details on that so I can like really pick that apart. But the cool part is I can introduce the force without doing a big load into the neck. It feels super gentle. We can measure everything coming back to a good position. And we can really make sure that we're hitting all these check marks that we're going for. So again, if you're dealing with migraine headaches, if you've had stuff going on for a long time, if you haven't had a really detailed structure evaluation, I'm a huge fan of chiropractic. Obviously, it's what I do for a living. NUCCA in particular, I'm on fire for. I've just seen so many cool changes for myself personally and for the people I've worked with over the past 10 years. So stay tuned for future videos. We'll get more into all this, but now you have a better understanding of different types of chiropractic and how it can help you.